But what people don't consider is that the muscle itself might feel tight because it's already in a lengthened position. Hey, Greg Chaplin here, physical therapist and strength and conditioning specialist. And in this video, we're going to talk about what to do about hip flexor tightness. And we're going to talk through a common cause of hip flexor tightness that happens especially in those cases when you've done all the hip flexor stretching and you've done all those posterior pelvic tilts, but still have that sensation of tightness. So we're going to go through why this happens first. Then we're going to talk through a few exercises that you can use if this sounds like you. So without further ado, let's go ahead and jump right in. So when we're talking about hip flexor tightness, the first thing we need to realize is that tightness itself doesn't tell us anything specifically about the position or the orientation of the muscle. So just because something feels tight doesn't mean that it's necessarily short, but it also doesn't necessarily mean that it's long. Now, a lot of people assume that the reason that hip flexors feel tight is because they're in an overly shortened position. And so that's why we throw things like stretching at hip flexors and posterior pelvic tilt type exercises to try to get that hip flexor muscle to go from a more shortened to a more lengthened position. But what people don't consider is that the muscle itself might feel tight because it's already in a lengthened position. And to explain this, we need to talk about how this hip flexor actually attaches both proximally and distally. So if we think about our primary hip flexor, so our iliopsoas muscle, we're going to have two divisions of that muscle. One that's going to be the psoas portion, which is going to start here at all the vertebral bodies and discs of these lumbar vertebrae, as well as actually the diaphragm. Then it's going to go down and over the top of the pelvis and then come under here and attach on the backside of this proximal femur. Then if we think about the iliacus muscle, that's going to start here on the pelvis, on that inner aspect of the pelvis, and then it's going to attach into roughly that same part on that proximal femur. So a lot of times people feel a sensation of tightness right here over the front of that hip. And so they're assuming that there's a shortened position of that iliopsoas muscle and they need to do stretching in order to alleviate that. But what we'll often see when that doesn't happen is actually that people have a little bit more lumbar flexion than they think they do, and they just go about exaggerating that when they're doing their posterior pelvic tilts. And so the proximal attachment site of that psoas muscle is actually constantly being lengthened. And so when we try to go and stretch into something like a hip extended position here, what we're getting is lengthening here at the proximal segment and lengthening here at the distal segment. And what often helps to alleviate this is learning how to get a little bit of lumbar spine extension, believe it or not, and being able to get a little bit more of a shortened position of that proximal hip flexor here, and then retraining the ability of that distal attachment to work both in a fully shortened position with flexion and a little bit less of a fully shortened position by moving this hip into extension while maintaining that slightly extended natural lordotic position here at the lumbar spine. The way that you'll know if this is actually what's going on with you is if you do the exercises in this video and you feel a sense of relief in that tight sensation in that hip flexor. That lets you know that you're probably overdoing your posterior pelvic tilts and you're probably creating a little bit too much lumbar flexion here during your exercises that utilize hip extension. So we want to retrain that, being able to both flex and extend the hip with a little bit more of a neutral lordotic position in that lumbar spine. If you're finding this video useful so far, consider subscribing to the channel if you haven't already. Leave me any questions you have down below in the comments and give this video a like. It helps the algorithm to help me help more people. Now, the first kind of exercise that we can use here is something like this prone on elbows breathing position. And what I love about this position is not only is it going to passively put that lumbar spine into a little bit of extension, but we can also superimpose some exhalation-based mechanics here, which is going to help that diaphragm relax. So if we are getting tension from the diaphragm into that psoas, this is going to remove that component of it. And then as we exhale and allow our lumbar spine to move down towards the table, we're going to get a very passive decompression of that flexion in the lumbar spine. So you're going to push up through your elbows, thinking about pulling your hands slightly apart so that your shoulder blades wrap around your upper back. We'll take a nice easy breath in this position, feeling the rib cage expand. Then you're going to exhale from here and you're going to allow the belly button to sink down towards the table here. And you're going to feel slight extension coming into that lumbar spine. Now, if getting into this position feels a little bit too painful, try to come up a little bit so that you're not pushing up quite as far. So you're bringing the arms a little bit further up so that you flatten out, or you can consider putting a pillow underneath the abdomen and the front of the hip. Once you're in this position and you're feeling comfortable and you feel like a nice distributed kind of a stretch in through the back or even a little bit through the abdomen or the front of that hip flexor area, you're going to repeat that breathing sequence, breathing gently in through the nose, and then a long, gentle exhale through the mouth or through the nose. Now, once you've got that type of position going on in the lumbar spine where we can get into a little bit of that slight spinal extension, then we want to work on making sure we can get the rib cage over the pelvis with the lumbar spine still in a little bit of that natural extension, but without having our center of gravity forward. So we can get into this kind of standing cross connect kind of a position and make sure that we get our weight centered over that back leg, but still feel that position of extension in the lumbar spine and that stack between the rib cage and the pelvis. Now, once we're here, we can work on some breathing, bring the opposite elbow towards the knee as we exhale. It's going to help to start to integrate some of those abdominals into this position of a little bit more neutral lumbar spine lordosis. And then once we feel comfortable with that, where we're able to control the stack of the rib cage and the pelvis, then we can progress to a lift off to help challenge that hip flexor muscle. So to do that, what we're going to do is take an easy breath in first, make sure we're balanced over the back leg, and then try to keep the pelvis level as we exhale and lift the knee just a little bit so your foot comes maybe like a ½ inch or an inch off of that step. We can hold in this position for a series of breaths or a couple of seconds, feeling that hip flexor engage while we keep that pelvis level, and then we can return back after that series of breaths. So we'll inhale here, exhale, just maintaining that position, nice level pelvis, making sure we can maintain that stack. And then to progress this activity, we can either add range of motion or we can make this a little bit more dynamic. So to make this a little bit more dynamic, we'll start in that same position, make sure the hips stay level, exhale as we lift off, inhale to return and tap, then exhale and lift off again. We want to work this on both sides, making sure we can lift up to at least this 90-degree position at the hip without any sort of a hip hike. If you're getting a hip hike, simply lower the step so that you're not challenging quite as much range of motion. Now, once you've got that position down, we can start to move to something that's a little bit more challenging, like a single or double leg hip thrust. So we'll get our shoulders on the bench. And then from here, we'll make sure that we have a little bit of that natural lordosis in that lumbar spine. We'll exhale so that we can bring the ribs down. Then from here, we'll take a breath in as we allow the hips to bend, that spine to stay in that position, and the pelvis and rib cage to stay stacked. Then we'll exhale as we drive down through our heels and bring the hips back up to that fully extended position. Inhale down, exhale up. And what you might consider with this is adding something between the knees just to make sure that you can keep that whole foot flat on the floor and that you're not over gripping some of those deep hip external rotators. Inhale down, exhale up. Then from this position, you can progress this by lifting one knee up to that 90-degree position that you worked on in the standing activity, inhaling as you come down, and exhaling as you drive to return to the start. Inhale down, exhale up. Okay, so that does it for this video. Just to recap, if you find relief with these exercises, I would give up those posterior pelvic tilting type exercises that you're doing that are promoting excessive lumbar flexion. I'd also give up the cue to squeeze your center abdominals and pack your back down into the ground with activities like leg lifts. If you do this for a couple of weeks, I think you're gonna find that you're moving a whole lot better with your gym-related activities, and that you don't have to stretch those hip flexors anymore because that sensation of tightness is gonna go away. All right, so that does it for this video. As always, thanks a bunch for watching, and until next time, peace.